Toothbrushing is the act of scrubbing teeth with a toothbrush equipped with toothpaste. Since only 2/3 of the outer tooth can be reached by a toothbrush, interdental cleaning can usefully accompany toothbrushing. Together, these two activities are the primary means of cleaning teeth, one of the main aspects of oral hygiene. Brushing teeth properly helps prevent cavities, and periodontal, or gum disease, which causes at least 1/3 of adult tooth loss. If teeth are not brushed correctly and frequently, it could lead to the calcification of saliva minerals, forming tartar. Tartar hardens if not removed every 24 hours. Poor dental health has been associated with heart disease and shortened life expectancy. History. As long ago as 3000 BC, the ancient Egyptians constructed crude toothbrushes from twigs and leaves to clean their teeth. Similarly, other cultures such as the Greeks, Romans, and Indians clean their teeth with twigs. Some would fray one end of the twig so that it could penetrate between the teeth more effectively. In the 7th century, Prophet Muhammad used to clean his teeth before and after sleeping. Following this man, Muslims clean their teeth every morning and evening. However, if possible, it advised to clean more frequently. Below a saying of the Prophet. Miswak is a root of a plant. When you clean your teeth with miswak, it will leave very pleasing smell. Tabrani narrates a Hassan narration on the authority of Hadrat Ali, citing that Rasulullah said, "If I did not feel that it would be difficult upon my ummah, I would have commanded them to perform miswak with every wudu." Mam'al-Uzat, Volume 1, page 341, Hadith 1238, in the time when Europe was suffering from toothache, Muslims were regularly brushing their teeth. Modern-day toothbrushing as a regular habit became prevalent in Europe from the end of the 17th century. The first mass-produced toothbrush was developed in England in 1780. In the United States, although toothbrushes were available at the end of the 19th century, the practice did not become widespread until after the Second World War, when U.S. soldiers continued the toothbrushing that had been required during their military service. Toothbrushing guidelines. Frequency equals, although there is a consensus that a thorough toothbrushing once a day is sufficient for maintaining oral health, most dentists recommend patients brush twice a day since a sufficient level of thoroughness in brushing is not normally achieved. Proper technique equals, the front and backs of teeth should be brushed with a toothbrush at a 45-degree angle towards the gumlin, moving the brush in a back and forth rolling motion that makes contact with the gumlin and tooth. To brush the backs of the front teeth, the brush should be held vertically to the tooth and moved in an up and down motion. The chewing surfaces of the teeth are brushed with a forward and back motion, with the toothbrush pointing straight at the tooth. Toothbrush. A toothbrush is an instrument used to clean teeth, consisting of a small brush and a handle. Toothpaste, often containing fluoride, is commonly added to a toothbrush to aid in cleaning. Toothbrushes come in manual and electric varieties. Although there is conflicting evidence as to which is more effective, most evidence points to electric toothbrushes with an oscillatory motion being more effective than manual toothbrushes, with toothbrushes lacking an oscillatory motion being equivalent. Both manual and electric toothbrushes are effective, however, and it is often recommended that people use whichever one they feel comfortable with and will be more likely to regularly brush with. Toothbrushes are offered with varying textures of bristles, and come in many different forms and sizes. Most dentists recommend using a toothbrush labeled soft, since firmer bristled toothbrushes can damage tooth enamel and irritate gums as indicated by the American Dental Association. Toothbrushes are often made from synthetic fibers, although natural toothbrushes are also known in many parts of the world. Those with dentures may also brush their teeth with traditional toothbrushes, specially made denture brushes or denture cleaners. Toothpaste. Toothpaste is a paste or gel dentifrice used to clean and improve the aesthetic appearance and health of teeth. It is almost always used in conjunction with a toothbrush. Toothpaste use can promote good oral hygiene, it can aid in the removal of dental plaque and food from the teeth, it can aid in the elimination and/or masking of halitosis when tonsil stones are not the cause, and it can deliver active ingredients such as fluoride to prevent tooth and gum disease. Tooth powder. Tooth powder is an alternative to toothpaste. It may be recommended for people with sensitive teeth. Tooth powder typically does not contain the chemical sodium lauryl sulfate, which can be a skin irritant. The function of sodium lauryl sulfate is to form suds when teeth are brushed. It is a common chemical in toothpaste. Those with dentures may also use denture cleaner, which can also come in powder format. See also: teeth cleaning. References. External links: brushing and flossing properly.